next skill we're going to do is how to suction a tracheostomy. Again, this is not best practice. This is to show you guys how to use ANSONS Arm at home and just to demonstrate the tracheostomy skill. So the first thing that you're going to do, of course, is check your doctor's orders, making sure what suction they want it at and if you're even allowed to suction on this patient. The next thing I like to do is just explain the procedure to the patient and to explain everything that we're going to do, because this is definitely a traumatizing and uncomfortable thing for the patient as well. The next thing I like to do, of course, is to put them in high Fowlers or semi-Fowlers just to get all the secretions down and to increase that oxygen saturation. On top of that, I like to put on a blue pad just to make sure that they are protected and there's not going to be any secretions around the patient. Next, you're going to open your tracheostomy set. I just have the dressing tray open right now because I don't have a tracheostomy set, so bear with me. You're going to pour some sterile water into that, and then you're just going to make sure that your catheter is clear. On top of that too, I like to have the oxygen right by the patient as well, so just in case anything happens, then I have oxygen right there, and I can just quickly add it to the tracheostomy, making sure that the oxygen is on as well. So we'll go ahead and wet our catheter tip, making sure it's connected to suction, and then we're just going to make sure that it's working and set it at the suction at the right rate. And yeah, we see that the suction is working. From there, we're going to insert the catheter into the inner cannula here, and we're just going to insert it until we meet resistance. And keeping the port open for now. And then once you hit resistance, then you can pull out, and then you can twist along the way and just apply suction intermittently with your thumb. So just like this. And you can do it for a max of 3 times. From there, of course, you're just going to check the oxygen saturation before and after. I like to just keep the oxygen saturation just on the finger the whole time, just to make sure it doesn't dip too low, and just make sure that your patient is safe the whole time. And then from there, just remember to document,